Well, I have something that I heard about the other day, and I said, this is, everybody's got to know about this. It's like the best hidden secret for those like our people. We can't give insurance here because the finances aren't here for it. But what we can do is this.
Absolutely.
And I've got Mario, Sheila, and guess who? Cindy. And they all sell this insurance. And this is for South Carolina. Is it like this in Georgia too?
It's nationwide.
Nationwide?
Yes, in Georgia, South Carolina, Florida, all across the country.
And it's Blue Cross Blue Shield. But talk about $0 per month employee health insurance.
Well, first of all, thanks for having us on. We really appreciate that. It's based on the Affordable Care Act that was introduced several years ago, back in 2014 or 13. It was,
Obama's?
Yes, the Affordable Care Act. And it was just widely misunderstood, very misunderstood legislation.
Very expensive, very bad.
A lot of agents didn't understand, so they left the industry. I almost did until I read it, and I understood that it is actual real insurance. It's Blue Cross and Blue Shield. We have an office in Aiken with Blue Cross and Blue Shield of South Carolina, and it is also. So the way this works, it's based on your income. Now, it is real insurance. It's the best insurance money can buy. It's just based on your income. Now, what President Trump did, effective January 1 of 2020, he enhanced it by allowing people to participate year-round. So before, you could only sign up November the 1st through December the 15th for a January 1 effective date. So what Mr. Trump did was he changed it so we can sign through a business, not individuals, but through a business. You can enroll like anytime.
Any of my people, if they would like to have it, they could enroll.
Right now, it has to be through your business. Now, you don't have to participate. Your company does not participate. You just there's a platform called ICHRA, and this is just it's a document that you have to agree to. And what this does is it takes away all of the constraints of the typical group insurance. Regular group insurance is so so expensive, so difficult to administer. You have participation requirements. There's 100 rules, and it's a small fortune. So through ICHRA, it allows the employer to do exactly what he wants to do, and in most cases allow that employee, if they qualify, to sign up through the Affordable Care Act through this ICHRA platform, which doesn't cost the employer a dime.
Not a dime.
Not a dime.
But I see here it says $0 per month employee health insurance.
Yes.
Now, how can that be?
Well, that's a very good question. The way the Affordable Care Act works is it's based on your income. So and it's not just for an individual. So if you make between $12,600, I believe, Sheila, or up to $15,000 a year, then your insurance, if you get the Bronze 4 plan and Blue Cross Blue Shield of South Carolina as an example, then your premium is $0. You have a doctor copay, you have a prescription drug card. This is the plan that I'm on, my wife's on, and Cindy's on.
And Cindy's on.
Yeah, this is as good as it gets. It doesn't get any better than this. Okay, so now, so if you make say 15.6, I don't do the day-to-day figures. I think it's 16.5 to like 25 or 30,000.
For a single person?
Yeah.
Single person starts at 13,000 and on up. And then if it's 2 people on your taxes, it's about 15,000.
But see, it also changes. So you say, well, I don't make $15,000. What if me and my husband, we make $60,000, which is reasonable income? Well, there's an example right here. There's a couple here that makes $60,000, 2 individuals with a family of 2 children. They have a household income of $60,000, and they still pay $0.
They still pay $0?
Yeah, so it's not just for the individuals. It's really done very well. It's scaled up. It's
Well,
scaled
who
up.
pays for this?
Well, it's subsidized by the federal government.
Somebody's got to pay.
Well, ultimately we do.
Yeah.
But you know, I'll be honest with you, Dorothy, transparent with you. I've been in this business for about 12 years. And before we had this legislation, we represent everybody. You know, United Healthcare, Aetna, Cigna, Humana. We're licensed
Medicare.
around the country. Everybody, yes. We've talked to many people across the country and locally that wanted to buy health insurance, and they had
can't
pre-existing.
afford it.
Well, there's two reasons. You could have all the money in the world, but if you have a pre-existing condition, then you cannot get it. A lot of private companies cannot afford to hire to insure somebody today and cover their pre-existing condition. If they have a condition that needs $300,000 worth of service, they can't take a $300 premium or a $2,000 premium and pay the $300,000. That's why most of the companies opted out of the Affordable Care Act. There are just a few companies in, and Blue Cross and Blue Shield is definitely the leader.
Okay, now say, and this is not happening to me because I'm not going to go there, but say somebody had to go to the hospital
Right,
and they had to have surgery,
like I did.
like you did. What just happened to you?
Well, I had a very bad burn on my arm. I built a gazebo in my backyard with a fireplace and a fire hearth, and I didn't light it right.
Did you burn the gazebo down?
No, I just
I'm worried more about the gazebo than
It burned his arm.
burned my arm.
Everything
So,
else is fine.
Things happen. So thank God we have the best facility, some of the best facilities in the area.
Yeah.
So my wife took me to the emergency room at the doctor's hospital, and no problem. Taken
No
care
problem.
of. Yeah.
But you have to pay the first $6,000.
Well, yeah, the deductible.
I mean, that's with.
Every plan has a deductible. Now you can buy higher plans with lower deductibles, okay? But like we explained to a lot of people, you know, you've heard the commercial, "This is not your father's Oldsmobile."
Yeah.
Well, insurance has changed. If you're looking for a plan with a $500 deductible, that's just not the way it works anymore. I mean,
Well,
that's
I have one.
well, I understand.
That's Share,
I
Medishare.
understand. I understand. What we do is and Medishare is very good, and so is AleraCare, and we represent them as well. They're very good plans. I have nothing negative to say.
The only thing is, a lot of people can't afford the $130 a month or
Well-
$150 a month premium.
Yeah, yeah. Well, that's where this comes in good as well. But the thing that you will find with the Blue Cross and Blue Shield is that all the preventative benefits are so wonderful. Like there's unlimited, you get your free physicals, you get your free labs. There are over 130 tests for women that are free. There's so many free benefits. I mean, when I say free, I mean free. Checkups are free. So it's really all encompassing, and then there are no limits. There are no limits to the coverage. So when this legislation was passed, it really enhanced health insurance. And of course, nobody can be turned down. You don't have to qualify.
But I mean, I'm hearing of these high-paying premiums
Mm-hmm.
with Obamacare. I have a friend that got on it. It's like $2,000 or something. She pays these high premiums and still only $6,000 deductible.
Well, you know, it's a lot of things are not misunderstood. It's important that you deal with an agency or an agent that really knows how to navigate the system. You know, anybody can call the marketplace, and the marketplace is a wonderful place, but they don't have the experience that an agent who's been in the business for 10 or 12 years or 15 or 20 years. So we know how to navigate it. Also, we can show you how to benefit by taking your zero premium and for perhaps, say, $30 or $40 a month, buy a supplement plan that will pay the gap, so you have no deductible. I know. So if you get sick, there's no deductible. If you have an accident, there's no deductible. So.
Well, Cindy, are you selling this now too?
I am. Actually, when I spoke with Mario and Sheila, and they were going through everything that they offer, which is everything, he allowed me to say, you know, Cindy, what would you like to work with? And I said, I want to do this because there's such a need. And I've experienced, you know, in the ministry and with friends and past employees that had to drop their insurance.
Yeah.
And then I had one particular girl that I did not know she had dropped her insurance, and then she was diagnosed with cancer. And I personally went through the trauma of not being able to get her seen because she had no insurance, and here she had cancer. And I didn't know that ever existed because I'd always had insurance. You know, I'd never really personally been around someone in that situation. And so, you know, I was able to talk with people that was able to get her in, you know, to be seen, but there was a lot of time wasted. And she didn't make it. But when I see this, and people, you know, they have to know we all need insurance. Period. And so this opens the door, and even if it's not zero, I mean, it might be $15. You know, it might be $17.
So if it's zero, okay,
Yeah.
it's zero, and say somebody has, they have to go to the doctor, so they haven't paid any premium, how does that work for them?
Just like they paid the premium. It's
Just a doctor copay.
Dr. Copay, go ahead, Sheila.
The premium is paid, but it's a federal, you know, subsidy.
Subsidy.
And so the insurance is being paid. It's just you're not having to be because you fall within the category. And so then it's the same as any insurance. You go to the doctor, whatever plan you choose, then it's your copay. It's, you know, $30 to go to your primary, $50 to go to a specialist.
Wow, and that's a
You know,
big deal, because you can't even go to the Medicare places around that, it's called Medcare, not Medicare. But I think Chris went there, and it was like 100 and some, 120 or something.
Yeah.
So copay would be like 60, right?
Depending on your plan. Right?
Well, yeah.
Well, like with
Normally
the
30,
Bronxville.
not over 30.
Not
for a
over
doctor
30?
copay, right. And they have got teledoc too. You can visit your doctor in the comfort of your own home for a lot of situations by visiting a doctor with a face-to-face video on your phone, which is nice, especially in this time where people don't like to get out as much.
Wow.
Yeah.
So this is really a great idea. I just, when she was telling me about it, I thought, wow, because that's one of my heart's desire. I think about all our people that work here, and I never was able to give them insurance. Now, I have faith that I'm not going to have to go, but you never know. So I just think this is absolutely awesome. If people want to get a hold of you, we have these flyers, and their number, is this where they call?
Yes.
The number is 803-761-0222. There's those 222s again. Something about 222, if you've been listening to Chris, that's right there. So Insurance Masters, it's 803-761-0222. If you want one of these brochures, I'll have some here for you. Come down and pick them up. The station doesn't make any money on this. We're just doing this to help you guys get insurance, because there are people who have not been able to get it.
And Dorothy, if there's a small business out there that in the CSRA area that you're in the same situation, because there is a lot of them that they maybe do the first tier of employers, the supervisors or whatever, but all of the regular hourly people maybe are not covered, then please call us and let us come and give you some information, and we can run quotes on your employees and see, you know, what they qualify for, and that'd be wonderful.
I want you to go to your phone if you have any questions about this. We normally don't do this like this, but I just felt such a heart when Cindy was telling me there's so many people that can't have insurance, and we can work with you on this. So go to your phone, give us a call.
When this act was introduced, the Affordable Care Act, it, again, grossly misunderstood. And many, many agents, hundreds of thousands of agents left the business. I almost left because I didn't understand. But I knew that, you know, the fact that it covers pre-existing conditions day one. We just have to educate everybody as to how this works. A lot of companies just don't understand. We have people coming into our offices. We have one in Augusta, we have one in Aiken, and I meet people and we talk about it, and they go, "Really, really?" I mean, people just don't understand. It's
For
crazy.
$20 a month, for those that have a bigger income, you said.
Now, if you make $300,000 a year and a lot of money,
300,000. No, look here. Family of 4, annual income, 60,000 with wife and 2 kids. Paid 0.
that's correct.
They
That's-
don't pay any monthly fees?
No, the plan actually does cost about $1,600. They just are exempt from paying that because they only make $60,000 a year. This is not a plan that was designed for people, for poor people. This is the Blue Cross and Blue Shield plan that I have. And if you make $60,000, you're a family of 4, the Blue Cross still gets paid. It's just that they don't have to pay.
But they don't have to pay.
They don't have to pay.
Oh my gosh,
Yes.
that is pretty awesome.
And if you have a family of 6 or 7, and if you make $100,000 a year, it's still. So they look at your income versus your family size and your household size. So if it's one person, then if you make $50,000 a year, then you may get some assistance, but it's not very much because you can probably afford to pay
So,
a couple $100s a month.
In other words, like the plan that my daughter and I are on is that we pay $150 or $130 a month, and it takes us up to $100,000.
Right.
Does this take you above $100,000?
This is unlimited.
Unlimited.
My father went in the hospital about 7, 8 years ago because I was in Hilton Head on a business trip. My sister called me, Dad's in the hospital, so I came back quickly. He was in the hospital for 2 days just for testing. It was $30,000. My first visit was $5,000. So I tell people, don't get caught up in the deductible. My wife had cancer many years ago. We had a $5,000 deductible. We elected that. That was in 2010, before there was Affordable Care Act. And University Hospital said, we'll work with you on that deductible, Mr. Oker. But they got paid with everything else, and we just made payments. So don't get hung up on the deductible. That's what I tell people. Get hung up on the fact that it's unlimited coverage. You can go and get the best coverage from the best surgeons, the best doctors, and if your bill is $10 million, they'll pay it.
There's no cap.
And there's no cap. And all of the preventative services, we have posters and posters and posters. I wish you could put our website up because it'll show we had 8 offices open at one time throughout Augusta. We were in South Augusta, we were in North Augusta, we were in Columbia, we were in Savannah, we were everywhere. Unfortunately, people did not understand it, so we didn't get much of a show out. We still did a lot, okay?
Yeah.
And it was the early stages of this whole deal. So, we grew, but now we've just toned down to 2 offices. But it's amazing. It's amazing coverage. It's the same coverage that they used to have. They haven't changed it. They've just enhanced it. And I say it's the Robin Hood theory. It's
Robin Hood, take from the rich and give to the poor.
Well, I wouldn't say that. But if you can afford it, you pay for it. But if you can't, you get assistance.
You have help, yeah.
Yes, you do have help.
I want to brag on him a second.
Yeah.
Because he is like the top person working with Blue Cross Blue Shield of South Carolina.
Wow.
And they really, I saw that in the first 2 days to where, this is what I love about Mario. Mario's brain just never stops. And he is more than just sitting here explaining this. He sees ways to make this happen for people. And that is what's so awesome, to where he goes, he has the knowledge. What he's saying about people like maybe your friend, I don't know if that's the case about, how they were directed with Marketplace, but it matters who you have help you.
It
of what they
does.
know. It's like Pastor Kennedy says all the time, if who's teaching you is dumb, then you're dumb.
Yeah,
Or you're going to miss out. So it's important to know who you're dealing with, an agent that understands and knows the current laws, and be able to help you and get you the best deal out there, because we all need that.
Yeah.
Well, thank you, Cindy.
But it's the truth. I was so impressed. I was so impressed because they really look to him, and he works hand in glove. It's not just a little office sitting over here on the corner of the street. He is so much more than that, with marketing, and that's why Blue Cross Blue Shield puts their whole signature on everything that Mario does. That's because they put they don't do that with everybody.
They don't. Mario, we have to talk when we get off the air, which isn't now. But I'm telling you, if you're interested, please give him a call. What's a phone call cost? Do it. if it could save you a lot of money, the extra money you could put towards a building fund.
Amen.
There you
Amen.
go.
Yeah.
Thank you so much
you
for
have
your
to have
ministry.
more money to get the kingdom message out. We're in the last days. We got to get it done. Thank you.
Thank you.
You guys are awesome. Cindy, I know this is going to be a fun job for you.
Oh, I'm already loving it. Because I love helping people, and I love going and talking to people, and I know a lot of people.
Yeah.
And so the Lord's just directing me, and just like when I called you, I'm not just on the phone beating the bushes. I'm really being spirit-led
Yeah.
on who to go to. And I have so much to learn, but look who I've got to teach me.
You
It's
got the
awesome.
best.
Exactly.
#1 guy in the South Carolina,
Yeah.
anyhow.
Only because of my good wife.
I mean, Sheila.
They're a wonderful team.
Let me see. There's always a good wife behind a good man.
That's right.
Oh yeah.
Right?
Hmm.
They work hand in glove, and his son.
And his son.
He's running the office today.
He's running it. All right. Well, thank you all for being here. Please, I'm going to have these here. If you have any questions, just give me a call, and we would love to have you. Listen, I hate when people have to pay these high premiums. It's awful.
Or be without coverage and in despair.
In
Or
despair.
or live with pain or sickness. I mean, you be healed of the Lord. You apply that, but it's also,
God uses
see a doctor.
doctors.
See a doctor. It's being in this business for so many years. It's like, oh, Sheila, thank you so much for getting us health insurance. I was in a coma. Just a regular healthy guy.
Yeah.
Some things went, and he was in a coma for a week, or cancer. Things pop up. So you help
Well,
people.
no
and
cancer
it's
will be on
wonderful.
my body.
Amen.
No plague will come nigh my
No
dwelling.
plague.
Yeah.
And no accidents in Jesus' name.
In Jesus'
Amen.
name, we
agree.
walk
Speak
and covered
to-
in the blood of
I'm
Jesus.
covered in the blood. Maybe you have an employer that cannot afford to do any kind of insurance.
Benefits.
This would be perfect. I'm telling you, I can't. This is perfect for our people, and I'm so excited. Cindy, I'm so glad you brought that to me, because that was one of my heart's cry, that they would have some kind of health care, because you never know.